Good day everyone. I'm John, moderator for this webinar. Welcome everyone for today's webinar, Understanding Patients' Eligibility, Copays, Co-insurance, Deductible and Past Due Balances 2023 Changes. I would now like to introduce our presenter for today, Stephanie Thomas. Stephanie Thomas, CPC, CAN, PC, has over 20 years in the medical billing world. She owns a billing, coding and consulting company and serves private practices across the US. Early in her career, she spent 9 years in a clinic setting where she was not only working in billing but also front desk manager. I now would like to over the floor to the speaker.
Thank you so much for that warm welcome, and welcome everybody to the webinar today. Our objective today, we're going to talk a lot about patient eligibility and the importance of this, how we do patient eligibility within our offices, how we understand those reports, implementing these processes within our own offices, and some tips on that, as well as we'll talk a little bit about pre-authorization and referrals. There's lots and lots of changes with that, both in 2022 and 2023 that we've already become aware of. We're going to talk about some tips and checklists and some common errors that we see with my own clients and, questions I get asked a lot. We're going to talk about patient involvement and how to protect your practice, and then we will leave some time for Q&A at the end of the call. Dive in. So insurance verification, very, very important part of a medical practice. If you're not doing this within your own practice, you need to definitely get off this call and sit down and make a plan to implement this immediately. This is one of the most important things that any practice can do to protect your bottom line. First things first, before we even do insurance eligibility, though, we need to have the right demographic information. So I'm going to climb up on my soapbox here really quickly and talk about your front desk and the importance of their job and their role. Every time this patient comes into your clinic, not just the first time, but every time they come into their clinic, we really need to get their address and phone number and make sure we have copies of their insurance cards and make sure we keep them current. So when we're running these eligibility checks, what exactly are we looking for? Obviously, is the patient eligible? But not is this patient just eligible for this insurance? Are they eligible for this date of service? We're also looking for their benefits. Is their copay the same as it was 3 months ago? Maybe there was an update. Maybe they've met their out-of-pocket maximum since then. Maybe they've met their deductible since then. What are their co-insurance rules? Is their deductible all paid up and now they don't have to pay a certain amount for their visit? They just have to pay a copay now. More importantly than even just basic benefits, we're trying to find out, is there any other coverage? Is this the patient's insurance and the patient's only insurance? So this is an actual eligibility report that I took out of a client system. Obviously, it's redacted, so you don't have any patient information here on the screen, but this comes right out of a practice management software. Here's another example of an eligibility report. This patient has United Healthcare, just straight commercial United Healthcare. You can see here, I also tried to take a little snip of the patient's insurance card. It's kind of blurry, but what I did want to show you is that this eligibility response that I got from United Healthcare, it was pretty long. You can see here I'm about halfway down in the actual report. It was a lot of information. So going outside of our practice management software, so I wanted to give you an example of an external report and what they look like. So this is coming from Ability. This is the same patient from this screen because there were so many things that were showing on this. So I wanted to go outside and pull the same exact patient up, but through an external source. So switching gears a little bit to referrals and authorizations. Like I was saying earlier, sometimes on these eligibility checks, you can get a little bit of information about if a referral or an authorization is required. And Blue Cross plans for sure will give you this information. And some Blue Cross plans, along with TRICARE and some Medicaid plans, require referrals or authorizations for even the first visit. A couple of common problems that we're seeing, again, circling back to these darn Medicare HMOs, Medicaid HMOs. Here's an example of a patient that came in with Medicare, where she swears she had Medicare. She didn't remember signing up for anything different, but when she gave us her Medicare information, I ran it, scrolled down to the bottom. Here's her pharmacy benefit with United Healthcare, and sure enough, she signed up for their medical plan as well. It shows here bill option code C, so it's Medicare Part C, and it says right here, Health Benefit Plan Coverage, HN, which stands for Health Network. Other common problems that we see aside from those darn HMO plans with Medicare and Medicaid. All right, let's switch gears a little bit about collecting patient responsibility. So it is much easier for your front desk and people to talk to your patients about balances when they're in front of their face than them getting a bill or having someone call them on the phone or having someone try to reach out to them by email or text. If the patient's right there and they obviously know they have a balance, likely they got an EOB from their insurance, they've probably gotten a bill from you guys in the mail, they may have gotten a text about a balance or an email. Also, if we can prepare the patient for what they're going to owe the next day and give them a chance to call their insurance if they have a question, call the billing department if they have a question, so it's not a big fight at the front desk, let's do that. That's definitely a better way of doing things. So you can also send this in their reminder. Maybe you send out text reminders, email reminders. You can also send them an invoice the day before. We have an invoicing system that we send patient email invoices the day before. That gives them a chance to ask any questions they have. We resolve any issues. Makes the check-in process a lot more smooth. Another thing that we recommend, and something that I do for my clients, is I prepare a copay or collection log for the following day. The most important thing about anything that you implement within your office is be consistent and effective. Do not start something and then only let it go for 2 days and then circle back a month later and wonder why it didn't work. If you've got a solid collection plan in place and your front desk is all on the same page, you've got an employee buy-in, your patients are aware, maybe you even say, starting January 1st, we're gonna collect past due balances at the time of service, then they should have this shouldn't be a surprise to them. We are gonna expect copays at time of service and past due balances are due at the time of service. Here's a little checklist that I made for eligibility and patient account success. So thank you so much. Thank you so much for having me, everyone. I really, really enjoyed giving this webinar today. I hope you have a great rest of your day.